In previous videos, we get to know some new acupuncture techniques of traditional Chinese medicine with the help of modern needle tool technology. Before that, correct and efficient diagnosis is undoubtedly an important foundation stone for the success of treatments. Dr. Gao, residing in Vancouver, regularly uses the pulse breathing ratio from Chang Song Jun to confirm the patient's physical condition and provide guidance for subsequent treatments.
Would you please tell us a bit about your condition before and after all the treatments?
Okay, about 1 year ago, I suffered heart attack. My blood pressure went so high that eventually, my heart couldn't take it anymore. So at the time...
From a modern medical perspective, pulse and breathing are objective performance of human body. And today, we will witness the pulse breathing ratio method, which first takes 1 minute to count the patient's pulse. After that, another minute to count the patient's breath. Each exhalation and inhalation count as one. Last, divide the pulse count by the breathing count. That's the result of pulse breathing ratio for everyone. A result number between 4 and 5 is a good indicator. 4.5 is the optimal balance data. When the number is higher than 5, it indicates that the patient tends to have restless pulse. And when the number is below 4, it means the patient's respiratory rate is relatively high. That's the manifestation of diminished qi. This pulse calculation method can help measurers judging their physical condition without diagnosing face-to-face or any assistance from medical devices.
My hand on one of the pulse and still observing his breathing. So right now the breath rate per minute is 16 per minute.
In 2019, Professor Li Shusen integrated his ancestral Chang Song Jun pulse method with years of clinical practice experience and shared pulse breathing ratio method publicly for free. This method can help TCM doctors distinguish between yin and yang for international patients effectively and accurately, so then they can really take the first step of treatment. Nowadays, it has been a standard already for our common smartwatches, wristbands, and stopwatches to providing a heart rate monitoring function. Not to mention that some mobile phones also have the function of monitoring rise and fall of the chest, so that even the respiratory rate can be recorded. With these fast and accurate auxiliary methods, a 3-minute pause is enough for each audience to get their own pulse breathing rate data.
The pulse per minute, so it's 60 beats per minute. But when I check patients' breathing, I try not to tell them.
Doctors would try to avoid speaking out the counting number while counting the patient's respiratory. This is because once the patient focuses on his own breathing rates, his respiratory rate may be different from that of his subconscious breathing. Experienced doctors will choose to observe the rise and fall of patient's shoulder and count the respiratory rate silently.
Pulse breathing rate is 3.3. Tianshu level is heaven. Below the Tianshu umbilicus level is earth. So if pulse breathing rate is diminished qi, we will treat below. We choose the points and meridians below on the earth region.
The pathogenesis of this patient with severe diminished qi is located on earth region. The main acupoint selection is on 3-foot yang meridians. Dr. Gao treated the patient with acupuncture, tonifying, and moxibustion for 1 year, with significant effects. The patient's heart function has recovered from 30% to 70%. Quality of his life has been greatly improved.
When you talk about your heart function is improved, how do you feel about yourself? How do you feel about the symptoms?
I didn't really have any palpitation at all. So I can do lots of work now, but I cannot really do anything heavy I used to do before, not yet.
Yeah.
So I do believe that will improve.
Okay.
Pulse breathing method is not only convenient for patients to self-diagnose. For TCM doctors in the previous diagnostic process, look, listen, question, and feel the pulse are basic methods. But these days, human activities are more free and living areas become more integrated. When doctor looks, they may see patients with different skin tone and texture. When doctor listen or smell, pronunciation habit and body odor caused by dietary habits of different ethnic groups is widely divergent. As for question, not to mention that if neither doctor nor patient communicates in their native language, then missing some content during the communication will be quite normal. After experiencing various interference terms, everyone's eyes will definitely be on the last method, feel, which means pulse diagnosis. It can be said that making progress in pulse diagnosis has become a very important demand for the internationalization of TCM.
It's a long journey. I was in a very terrible car accident in 1988. Was in the hospital for many months. Ended up having hip replacements, elbow replacements, and broke every bone on the left side. I was in school at the time, studying to be a pathologist. I had such bad short-term memory, and then I had to retire because I couldn't, my memory went. But then after that, everything's just digestion problems. The symptoms just progressed and got worse and worse. Considering how long I'd had the symptoms, 25, 30 years, my wife you saw incredible improvement. My quality of life changed completely.
So if we calculate, it's a 60 pulse heart rate.
Now, we have counted Dawn's pulse at 60 beats per minute. Respiratory rate is 10 times per minute. The ratio number has reached 6, indicating severe restless qi. Root cause of restless qi is dryness heat traveling upward from lower limbs. Qi's movement in patient abdominal is obstructed so that various types of pain have appeared. The patient has been experiencing colitis, anxiety, and palpitations for many years. Also severe symptoms such as umbilical, abdominal cramps, and colic. The pathogenesis of restless qi is in heaven area to treat the patient with severe car accident sequelae. Dr. Gao mainly chooses the heaven area meridians, such as purging hand Yangming, hand Xiaoyang meridian points.
So more point on the heaven area. So right now we need to 下关. Please open your mouth. Is it okay? Yeah.
It's amazing.
Okay.
In addition to targeted acupuncture, Professor Li Shusen found that Xiao Jianzhong decoction, a classic medicine, is particularly effective for treating diminished qi, such as the first patients in our video. Among them, Huangqi Jianzhong decoction is suitable for male, and women are suitable for Donggui Jianzhong decoction. It is very important that the original formula contains malt sugar. Therefore, diabetics need to use Glenier Radix instead. Other than taking medicine as needed, persist in drinking water boiled with jujube, ginger, and brown sugar, or food tonic method, such as drinking gruel, also moxibustion, at Dusanli, can also achieve good results. Fingrun Xixianglun of Huangdi Neijing Suwen had talked about people exhale once, the pulse beats 2 times. People inhale once, the pulse also beats 2 times. Completing a respiration costs 5 pulse beats, which is the prototype of the early pulse-breathing ratio concept. The book also mentioned the physical condition, while pulse-breathing ratio is in other ranges, and provided further guidance. Leap breathing is also written in the book, which means a slightly longer interval often occurs between normal breathing. This is consistent with the normal pulse and respiratory rate data in modern medicine. Some people have a normal pulse while not exercising, but appear diminished qi or restless qi after exercising. This indicates that he is still in a state of sub-health. This also has many similarities with the treadmill test in modern medical testing. Measurers with mild abnormality can use acupuncture, moxibustion, gua sha, decoction, exercise, and other methods. For those with severe abnormalities, a comprehensive medical examination is highly necessary. For people who are prone to have symptoms such as chest tightness and palpitations after exercise, it is typical restless qi. Da Chai Hu decoction can adapt more widely. The Bupleury, Phanelia, and Scutellaria in it can reconcile the Xiaoyang. Chinese rhubarb, white peony, and other medicinal herbs are for relieving dryness heat. Just to remind that Da Chai Hu decoction should be used with caution during women's periods. Without the use of medication, boiling water with white radish or boiling water with ginger, brown sugar, jujube, and chrysanthemum is also a daily choice of dietary therapy. It is noteworthy that the pulse breathing rate numerical value of human body is always in a dynamic change. For example, a decoction may quickly turn a restless qi patient into the state of diminished qi. Therefore, it is necessary for us to keep an eye on pulse breathing data and adjust medication plans any minutes.
About 6 years ago, I had a car accident. And afterward, I have something called post-concussions syndromes. I have ongoing nausea, feel like I'm always in balance. And then I also have cognitive issues. My brain is very slow. Reading is an issue. And also, after car accident, I develop anxiety.
For now, the patient's pulse is 80 per minute. breathing rate is 15 times per minute. A pulse-breathing ratio data over 5.3 indicates an obviously restless Qi. Considering that the patient may experience dizziness, difficulty concentrating, and vomiting, anxiety after a car accident, we believe it was blood stasis obstructing the brain's meridians and caused the dryness heat. But long-term illness is also consuming Qi in blood. This can also be proven by the fact that patients often have hot faces but cold hands and feet.
Purge Li1 and purge Li11.
Since the pathogenesis of restless Qi is in heaven area, Dr. Gao selects 3-hand yin and 3-hand yang meridian in heaven area, collaborated with some abdominal acupoints.
Tonify lung A. So acupuncture help you quite a bit.
Yeah.
For improving side effect and then from the concussion.
It's improving. It's still a long way to go, but without the help of acupuncture, I don't think I'll come that far.
Okay, so today...
The next patient has anxiety already. The main symptom at the time was having his waist twisted 2 days ago. His ability to bend was even limited because of the pain. Through pulse breathing ratio method, we quickly concluded that he was in a state of diminished Qi.
We treat a patient for diminished Qi. We like to look for the points and meridians below stomach 25, Tianshu, on the earth region.
Dr. Gao selected foot acupoints to relieve back pain. Patient was asked to slightly move his back after needling. The pain significantly alleviates by 80% within 10 minutes.
Where you go and then bending. So how do you rate your pain level from 1 to 10 before and after the treatment?
Probably before the treatment, pain was around 5.
Yeah.
Now it's down to probably around 1, unless you put pressure on it. But right now,
It's called
no, it don't.
All right.
Professor Li Shusen often mentions when imparting the Changsong Jun pulse method that self-testing pulse breathing ratio is like making a weather forecast for your body. Check if the body is sunny and breezy, hot and scorching, or rainy and cold. As the only quantitative and qualitative pulse index in the current field of TCM, the ratio method is easy to operate, which also has a clear standard and strong repeatability. It is the inheritance of Huangdi Neijing spanning 2,500 years and will continue to bring easily accessible benefits to thousands of families.